So what happens during a hearing test? What does that look like? There are many components to a hearing evaluation. In step one, we talk about your hearing history, how your hearing health is, maybe where you're having difficulty understanding people. We don't want to miss any steps in this part because it gives us such a great background of what you're experiencing and what's been happening so far. Step two, we take a look in your ears. We use an otoscope and we check the ear for any type of wax, any growths. We look at the eardrum to make sure it's a healthy color. We look for retraction pockets. That means like if you've ever been up in an airplane and you felt like your ears need to pop, that feeling causes your eardrums to suck in. And so we look for that retraction. We also look for any signs of infection, fluid. If there's a perforation in the eardrum, we're going to try to visualize that. So we take a look in your ear to make sure everything is clear, good, and healthy to that point, to that eardrum. The next step, we'll put you inside a booth, an exam room booth, so that we can cut out any types of background noise. We want to make sure that it's completely quiet so that we test everyone exactly the same. This way we can control how much sound is around you. So it doesn't matter if you're tested in our Farmington office, our Herculaneum office, the Kirksville office, the Maryville office. It doesn't matter which of those you go to, you're still going to be inside a booth that helps dampen the sound significantly so that we can control each environment and be able to compare test to test well. During your hearing test in the booth, during the diagnostic evaluation, we put foam earplugs in your ears. We use these foam earplugs instead of a headset because with the foam earplugs, once we insert them, it expands and it fills the whole ear canal, just like a hearing protection device. Like if you got those foamy ear protector things, you stick them in and they blow up. It's kind of like that. They expand like that. So that's what we put in. It's called an insert headphone. It's a best practice form of testing. So we put these expandable earbuds in your ears. And the reason we like that is because it holds that ear canal open. As we get older, you may notice that there's some loose, flappy skin in different places, unfortunately. When we put headphones over your ears and we push that ear in, sometimes that loose skin in your ear canal can actually close your ear canal off. And we don't want that to happen during a test. So we always use the expandable insert headphones so we don't have to worry about that ear canal collapsing. Once the earphones are in place, we're going to do some word testing. First of all, we're going to see how well you can correctly repeat back one word. And we're going to turn that one word down softer and softer. So it may be a word like baseball, and then you say baseball, and then we turn it down. We want to see the very quietest point that you can understand speech. It's very much like the eye exam that I just had this week, where they ask you what's the lowest line on the graph that you can read. It's the same thing. What's the softest volume you can hear and still understand the word? So that's the first test. After that, we complete another speech test. This time, it's at a comfortable volume. It's something that you can understand well. We want to know if you have no context and no idea of what the conversation is, how well can you hear a word? So what we'll say now is something like, say the word toast, and you repeat the word back. Then we say the word cat, and you repeat that word back. So it's a phrase that we say over and over, say the word, so you know it's coming, you know it's almost there, but we just want to know how well can you pick up that word when there's nothing else going on. You don't have any clues, no visual clues, you can't see our faces, no audible clues, like you don't know what the topic is. It's just random words. So that's the second speech test. The third one is the one that I like the most because many people say, well, I hear fine and quiet. It's in background noise that I struggle. So as a part of best practices, one of the things that we always want to make sure to do is to test people in noise. we have a test that we can administer, that we do administer every single time. And you hear chatter. It almost sounds like you're in a cafeteria without the silverware. You know, it's just like it's just a bunch of people talking. And you'll hear a man saying a sentence, and you try to repeat back the sentence. The key is it's going to happen 5 times with 5 different sentences. It starts off in the beginning with that chattery background noise, very quiet. The second sentence you hear, the background noise becomes louder. The third is louder, the fourth, and then the fifth is the loudest. And I have to be honest, if I didn't know what the man was saying on the 5th sentence, I wouldn't get it. And my hearing is pretty normal, so it's pretty rough. But the point is trying to see how well can you understand a slew of words over what level of background noise. How loud does the background noise have to get before it becomes an issue for you? So being able to say, I don't hear well in background noise is one thing. Being able to say, you hear fine until the background noise is this level is something else. It gives us more clarity in where the problem's happening and why it's happening. The last part of the test, or the next part with the insert headphones, is something that you're going to be more familiar with and what you may think that a hearing test is like. You hear a series of beeps. Every time you hear a beep, you push down on a button. The beep gets softer. If you hear it, you push down. It gets softer. If you hear it again, you push down. And we do this for a lot of different pitches. And by pitch, I mean like the piano keys. Like there's different tones. There's low tones like bass sounds, and there's really high tones like the treble sounds. So we do a range of those. And the only range that we really focus on is the speech range. Our ears can hear hundreds of different pitches, thousands probably of different tones. But the only ones that we really focus on are the ones that carry speech. So we're primarily looking at, why are we not understanding words? Where's the breakdown? And it may just be at one tone or one pitch. And at least that gives us clarity of, people thinking, is it all in my head? Is my wife just nagging me? Is it real or not real? Like, we don't really know. So that test gives us a lot more clarity on what's happening. The final thing we'll do is we take those insert headphones out and put them away. We take them off and throw them away because that's sanitary. But we use what's called bone conduction. And so it's a box that sits behind your ear, and it has a headband going over the ear. So it sits kind of cockeyed, where it's behind the ear here and on the forehead over here. And that puts pressure on that bone behind your ear. That's the mastoid bone. That bone, whenever we vibrate it, hears sound. The really cool thing is it hears sound directly to the nerve. When we put the insert headphone in, we're testing the entire system. We have the ear canal, making sure if there's any wax in the way. We have the middle ear space, making sure there's no fluid or infection there. We have the inner ear, where sound is processed or collected and maneuvered into from a mechanical sound into a stimulated sound. And we have the nerve going to the brain, and then the brain has to understand what's been said or what noise you're hearing, or the tone has to understand what it's hearing. So the really cool thing is the insert headphones test that entire system the whole way. I kind of think of it like a train on a track with depots. It hears to here, and then it goes to there, and then it goes to the brain. The part that goes behind your ear, the bone conducted, goes straight to the nerve. It bypasses. So you're not hearing the sound out of your ear canal. You're not hearing it through your eardrum. You're hearing it through your inner ear, nerve, and brain. So it just does that section. That way, if, let's just say, for instance, there's some kind of a growth in your middle ear, we can say there's a gap between your hearing here and your hearing here. Whenever we put the insert headphone in, the sound has to be much louder before you can hear it. When we put the box behind your ear, it doesn't have to be that loud. There's a gap. There's something stopping the sound from getting through the normal, natural route, but your hearing nerve is fine. Let's figure out what's blocking that. And that's our main role as audiologists, is finding out, is there a hearing issue? What's causing it? And why are you having the struggles that you're having? Those are the 3 things that we're trying to answer when you come in for your hearing test. So in the end, after the bone conduction test is completed, that's different pitches. I'm sorry, I didn't say that part. That's hearing different pitches and hearing a tone again. You hear the beep, hit the button. You hear the beep, hit the button. It keeps getting softer and softer and until you're not hitting the button anymore. And that tells us that's the very softest that you can hear that sound. So we complete that tone testing through both the insert headphone and the bone conducted or the headband that goes there behind your ear. When that's completed, we have you step out of the booth and we sit down and talk about those results. We talk about what's causing problems. Why are you not able to hear your friends in the Mexican restaurant? Why are you not able to hear your wife when she turns and walks away from you? Why do you have to turn the TV up so loud? Why do you struggle on the telephone? We can look at that hearing test and we can tell what's happening and why. We send this also to your physicians because if we see an issue that could be medically treated, we're going to do that first. That's always our number one goal, is to make sure you're hearing your best, the healthiest way possible. So if we see an issue with the ear where it's maybe unhealthy in some way, we're going to send you to an ear, nose, and throat doctor so that we can get that taken care of as quickly and easily as possible. If it doesn't look like something that either medications or surgery, something like that would help, if that's not an option, it looks like it's a nerve hearing loss, then we talk about amplification. We can talk about hearing devices that can help you get back into those social activities that you want to be in. So I hope you found this helpful and feel more comfortable about your visit for a hearing test. You can make your appointment at hearingcarepartners.com, where we listen so you can hear.